We'd already had service improvement running for a number of years. We felt that by introducing a standard approach and making sure that that training was put in place in an ordered way for all levels of staff, it would help us succeed.
We looked at a number of proposals that came through. It was Capita's approach to working with us to train our staff in delivering change. So it was a much more supportive and partnership approach.
The biggest obstacle I had was getting my consultant colleagues on board. And it was getting their engagement and feeling this wasn't a threat to their clinical autonomy. This was actually going to be better for them and for patients and for their teams. The most important thing that we learned through working with Capita was the importance of staff engagement. It's about getting everybody in the organisation behind the changes you want to implement. It's about understanding what lean is. It's about doing things more efficiently and better for patients.
When we started out on the programme, we used what we described as our events in the tent. We had up to 100 people in the tent at any one time going through a change process, and I remember Natalie in particular getting people to change something about themselves, which included taking items of clothing off and swapping it with others. It was a really good and positive experience for the staff that came along to those sessions to understand what change can feel like.
It really did galvanise and fire up the organisation in a way we hadn't seen before. It gave people the opportunity to understand how they fitted into the whole picture of the organisation, and therefore what they could do, what they could change that made the organisation better.
My experience of working with the Capita team was very educational. It made me reflect a lot about how we introduce change. It helped me to look at the whole process that a patient follows and drilling down into what's important and what's not important.
What has lean brought to this organisation? It's brought a level of scrutiny which wasn't there before, and it's meant an honest appraisal of what we've been doing without threatening an individual operator.
People approach change now in a much more considered way, involving the right people in decisions, also involving the voice of the customer, whether that's patients, relatives, staff, and I think that's really important.
My best memory of the programme, I found it still invigorating. I liked the structure to it. It worked, and it was a structure that works all the way through the organisation. Didn't matter what level we were working at, everybody got it. And for me, I think that was the great thing, because then you get this great groundswell of people. They know what you're talking about. And there's nothing really more powerful than when the whole organisation starts to move in the same direction.
Well, the experience here at Papworth has been really positive. Our staff have responded very well to it. Capita have been very flexible in the way that they've helped us with implementing and training staff within the organisation. So I would definitely recommend this approach as opposed to others.
This, to me, has had the most success of anything we've done, and it's embedding it into the culture of the organisation. The organisation is not afraid to change now. It sees change as beneficial. So I would say it's been very positive, and of the various options we've tried, this is the one that's worked.
I would definitely recommend the experience of the Lean programme to other NHS trusts. I think we have gained a lot here at Papworth. We have a total different approach now to introducing any change, and the most important thing is that it's the patient who's at the centre of it.